Hi everyone, my name is Olivia Blunt. I'm a nursing student here at Miles Community College, and alongside me presenting today, you're going to be seeing fellow nursing students, Caitlin Shaver and Taylor Price. So welcome to Virtual Brain Bingo. Essentially, we're going to be able to play bingo with you across this computer screen. So grab some friends, social distancing of course, and either download or print off this Brain Bingo card. All right, now that you've either downloaded or printed off this Brain Bingo sheet, let's get started. What this game is going to do is going to cover different mental health and cognitive issues that college students either face directly or indirectly. And by doing this, we're going to be giving you the definition, and we want you to find the term on your Brain Bingo sheet. We will be giving you the answers as we go along, but the first one to get a bingo will win, but try to go for a blackout so you can learn all of the terms. Okay, so the first definition I'm going to be giving is that this is a mood disorder that is characterized by persistent feelings of sadness or loss of interest. You may have trouble completing normal day-to-day activities, and sometimes you may feel as though life isn't worth living. So I want you to go and look in your board and see what term you think that definition fits. Give you a few more seconds. And the answer is depression. So depression includes feelings of sadness, tearfulness, emptiness, hopelessness, anger, and much more. With depression, it's a common disorder that affects a ton of college-age students. So don't be afraid to reach out and grab help because it's very common, and there can be a lot of good help out there for you. Okay, so the second term we're going to be covering is that this is damage to the brain from interruption of its own blood supply. I'll give you a few seconds to kind of see what term that would be on your card. And the answer is stroke. So with stroke, you're going to want to memorize this mnemonic, be fast. Be fast stands for loss of balance, loss of vision in one or both eyes, facial drooping, usually on one side or the other, one of your arms hanging lower than the other if you were trying to put them out like this, slurred speech, and then time, which is you need to call 911 immediately. And risk factors for this are also important because as we grow older, we really want to prevent strokes, and we can start preventing those by modifying our risk factors now, which include our weight, our diet, our exercise routine, our smoking, our drinking, all of that. If we can control those now, that can help us a lot in the future. Okay, and the third term we're going to go over, the definition is a chronic progressive neurodegenerative disease of the brain. Now, this is going to affect 60% of all dementia cases, and it affects about 11% of all people over the age of 65. It's also known as the long goodbye or death in slow motion. So I'll give you a few more seconds to kind of see what term that would be. And the answer is Alzheimer's disease. Now, that probably necessarily isn't going to affect a ton of college students directly, but I'm sure we know someone, or we know someone who knows someone that has Alzheimer's disease. And there are 3 stages: mild, moderate, and severe. Mild, you're just going to see minor memory loss here and there. Moderate, you're going to see more apparent memory loss. You're also going to see some paranoia, maybe some hallucinations. And then severe, you're going to see them not be able to necessarily talk, walk, eat, have bladder and bowel function, things like that. Next, I'm going to be covering this term, and the definition is this disorder frequently has intense, excessive, and persistent worry and fear about everyday situations. Common signs and symptoms include feeling restless, nervous, tense, having a sense of impending danger or doom, sweating, trembling, having trouble concentrating, things like that, having worry about things you can't control. So I'll let you kind of look around your board here. And the answer is anxiety. Again, this is a very common disorder that a lot of us face in college. And again, don't be afraid to reach out and get help. There is help out there, whether you go to your doctor, to a counselor, talk to someone, and they'll be able to direct you in that right way. Okay, so my next definition is that this is the second highest cause of death among college students. And unfortunately, this is suicide. So 3 out of 4 students have reported experiencing at least one stressful life event in the past year. And in fact, 20% of these students experienced 6 or more. And so this stress exposure is strongly associated with mental health diagnoses, self-harm, and suicidality. Get help. Don't battle alone. There are resources which we're going to be talking about This is related to depression and anxiety, so do not be afraid. The fact that suicide is the second highest cause of death in college students says something about how we need to get help. And if you see someone struggling, don't be afraid to ask them about it or get help for them. Okay, so the last term I'm going to be covering is that this is the number that should be put in all students, all people's, all faculties, everyone's phone, as it can literally save lives. And this is 1-800-273-8255. Put that in your phone, memorize that number. That is the suicide helpline. If you know someone struggling with suicide, don't be afraid to call it. If you are struggling with suicidal thoughts or suicidal intentions, don't be afraid to call it. That number can save your lives and it will direct you in the right direction. Alrighty guys, well I hope you are having fun so far. I hope you are learning a lot. And if you've gotten a bingo, congratulations. If you haven't, keep playing. And even if you have gotten a bingo, keep playing for the blackout. Next, I'm going to be passing on to Caitlin Shaver. So what you'll see on the screen next is the definition, and then she will be giving you the answer.
Insomnia is difficulty falling or staying asleep. College students are more likely to have issues with insomnia due to stress and studying. Insomnia can be reduced by decreasing caffeine intake 4 to 6 hours before bed, using background or white noise as a sleep aid, putting your phone away, and getting enough exercise during the day to burn off energy. Hypersomnia is difficulty functioning during the day due to excessive tiredness. Signs and symptoms include slow thinking or speech, inability to concentrate, anxiety, irritability, low energy, and difficulty remembering. Lifestyle changes are a crucial part of treatment. Avoid drugs and alcohol, maintain general physical and mental health, establish healthy coping strategies, get proper nutrition, and maintain adequate sleep hygiene. Stress is any reaction by the body when changes occur. Under normal circumstances, stress is dealt with easily. When stress is repeatedly experienced with no relief, it can cause health problems such as headache, upset stomach, elevated blood pressure, and problem sleeping. Stress can be managed by keeping a positive attitude, using relaxation techniques, exercising, and setting limits to stressful situations as appropriate. Bipolar disorder is a lifelong mood disorder characterized by drastic changes in mood, energy, and activity levels. Signs and symptoms of bipolar disorder are manic moods or feeling up and elated, hypomanic or down moods, loss of appetite, fast talking, racing thoughts, or having trouble concentrating and making decisions. Treatment for bipolar disorder includes medication and psychotherapy. Delusional disorder is a mental disorder with delusions being the main symptom. Usually delusions involve experiences that are exaggerated or mistaken. Other symptoms are hallucinations, irritability, feeling angry, or a low mood. Treatment of delusional disorder includes antipsychotics, psychotherapy, behavior therapy, and cognitive therapy. Alcohol substance abuse. College students often turn to drugs and alcohol due to stress, increased workload, peer pressure, or just out of curiosity. 4 out of 5 college students use alcohol. www.addictioncenter.com/college has the ability for live 24/7 chat, and more information and help can be found at www.samhsa.gov. Cramming, an ineffective and commonly used method of studying for college students, usually done the night before a test. The reason that cramming doesn't work is that our memory is only able to hold so much information at one time, and staying up late to study affects our sleep and rest.
Hey you guys, I'm Taylor Price and I'm a student nurse with Miles City Community College. As you know, we're playing Brain Bingo. At this point I'm the third person, so I'm just gonna finish off with the rest of the terms and hopefully somebody wins bingo. Okay, so this term is the adequate amount of sleep to maintain adequate mental and physical health for college age students. I'll give you a second to find the square. So this is 7 to 9 hours. That's the appropriate amount of sleep for a student, but hypersomnia and insomnia is both common, and above one of the girls talked about that. Hypersomnia being too much sleep, and insomnia is either not sleeping, inability to fall asleep, something along those lines. A good way to get those 7 to 9 hours, because it can be hard with school and work and families, is developing healthy sleep hygiene. We'll talk about that a little later, so I'm not going to lead into that. Our next term is kind of long, but it's an important one. Counseling is offered on Monday, Wednesdays, and Fridays from 8 a.m. to 12 noon. Counseling services are intended to provide support in helping students balance intellectual, emotional, and interpersonal and developmental needs. To schedule an appointment, a student can stop by the Student Services desk to schedule. For students completing their first appointment, they must complete patient intake form that will be shared with One Health to establish patient records. The Dean of Student Engagement and Auxiliary Services is located in the Student Services or can be reached at 406-874-6226. I'm sorry. I'll give you a second to find that square. So this is school support. This is actually offered by our school. This is all the details that our school offers. The Monday, Wednesday, Friday is for appointments. It's linked with One Health, and the number is 406-874-6226. This is a super cool privilege that we have at our school. I highly recommend taking advantage of it. They're very professional, and this whole thing is kind of backed on mental health, and I think it should be taken advantage of. So the next term is, it can also be considered a mild traumatic brain injury. It is a brain injury that occurs when force is transmitted to the brain, causing it to move quickly within the skull. The sudden movement causes a disruption in how parts of the brain communicate and result in a variety of symptoms. I'll give you a second to find the square that you think it is. So this one is a concussion. A lot of people in high school sports have probably had a concussion, and it actually becomes dangerous the more concussions, the more severe, the more likely of permanent brain damage, severe or mild, whatever it may be. There's a whole list of signs and symptoms. Common ones are headache, nausea, vomiting, balance problems, sensitivity to light. You can have short memory loss. You can have mental fogginess, trouble falling asleep, anxiety. There's a whole list. Our next one, the term is drinking, substance abuse, sexual partners, impaired driving. They are all kind of categorized under this one term. So this one is high-risk behavior. High-risk behavior can increase risk for accidental injury, increased risk for disease, increased risk for death, and an increased dropout rate in college students. It's very common. Students, especially young college students, I know Miles City is, the more traditional students is older, but high-risk behavior is common because we're all being let loose in the world without really parent guidance. It's our first time really kind of out on our own. These changes, which the new environment of college is, can lead to an increase in the stress level, compromise, and behavioral problems in students, including risky behaviors. Risky behaviors are behavioral and social disorders that threaten social order. So this is by a name I'm not even going to try to pronounce because I'll butcher it. Our next term is a type of amnesia, not being able to remember what happened when you were drinking or using drugs. So this term is blackout intoxication. In a blackout, you lose short-term memories. During a blackout, you may function normally. People around you may not notice anything different about your behavior. You might do things that you normally do, such as eat dinner, wash dishes, or watch TV. But later, you have no memory of doing them. So that was through the University of Michigan, that statement there. The occurrence of a blackout can lead to events you would also normally not partake in, such as intercourse, use of other intoxicating substance, and other high-risk behaviors. So blackout intoxication is actually really dangerous. It can lead to STIs, pregnancy, injury if you get in a vehicle when you're blackout and you don't realize it and you get into an accident. And kind of like a concussion, blackout intoxication, the more you do it, the more damage you can do to your brain. So it's really important to drink responsibly if you are going to partake in behaviors such as drinking or drug use in college. Our next one is, this causes different effects on the body, including thickening of the blood, increases the risk of blood clots, and narrowing of the arteries, as well as restricting oxygen in the blood. This is by the Stroke Association. It can increase risk and severity of stroke and hypertension. So this term is smoking. I pretty much covered everything I kind of want to say about it. It increases your risk for stroke and hypertension. So just don't partake. It causes cancer. It is bad for other people if you're smoking around other people. So be conscientious about smoking, please. Our next one is change in activity, eating habits, and social habits such as drinking and smoking, increased financial dependence, such as you can't afford to go to the doctor, can all lead to increased blood pressure or undetected increases in blood pressure. Increased blood pressure can lead to stroke, anxiety, or anxiety can lead to increased blood pressure. The answer to that one's kind of in the statement. The answer is high blood pressure on that one. So this one I kind of talked about earlier. A nap, either 15 to 45 minutes, is good and rejuvenating. More than 45 minutes can cause increased drowsiness and affect nighttime sleep. Sleep scheduling, which is going to bed and waking up at the same time. Avoiding staying up late or all night. Turning off screens 30 to 60 minutes before bed. Exercise, but avoid sleep within 2 hours of avoid exercise within 2 hours of sleep. Avoid caffeine and alcohol at least 4 hours before bed, and create an environment to promote sleep, such as cool, dark, and quiet. These are all part of what's called sleep hygiene. So we talked about that one with the 7 to 9 hours of sleep for adequate mental and physical health. It's important to maintain all those things to have good sleep hygiene. So these last two aren't really mental health or brain related, but I think they're appropriate for right now. According to the CDC, you are not considered to be in contact with the illness unless around someone who is symptomatic, within less than 6 feet of them for more than 15 minutes. So this is your risk for contracting the coronavirus or COVID-19. That statement is not for all illnesses. It doesn't go for influenza, but to be in contact with somebody that is symptomatic within less than 6 feet of them for more than 15 minutes is when you're going to be considered in contact with somebody that is ill. If you just walk by somebody and they sneeze, that's not considered in contact with them. So this last one, this is a website that is a good resource for all aspects disease control. In this time of chaos with COVID-19 pandemic, utilize resources, educate yourself, and be prepared to facilitate your community in any way needed. Stay calm, cover your cough, and wash your hands. So that one is cdc.gov. And that was all of our terms. I just now want to thank you guys for playing along. I know this isn't probably what you pictured for our campus community get-together. I hope you guys learned something new and take advantage of the knowledge as well as the support and resources we mentioned in the game. I hope you guys print out this sheet. You may not reference the terms ever again, but there's important phone numbers on there and resources that you guys should take advantage of. Thank you guys for stopping by.